Hello, everyone. Welcome to Health Builders' first visual event, Coping in Crisis. My name is Nancy Reynolds, and I'm the chair of the board of Health Builders. We're so delighted you could join us today to learn more about the history of Rwanda. We will talk about the resiliency of its amazing people and their ability to come together to reshape their future after the tragic and devastating genocide against the Tutsis in 1994. Before we get into the content, please allow me to take a few moments to explain the work of Health Builders and their role in helping to rebuild the country and what the impact of support from individuals like you means. So, about Health Builders. Since 2007, Health Builders has worked to strengthen healthcare systems in Rwanda. We do this by focusing on management and clinical skills in primary health centers. This is where more than 90% of Rwandans receive their health care. We work in the most rural parts of the country, providing safe and effective health care across the lifespan, from birth through childhood into adolescence, adulthood, and through to the end of life. We have built 7 health centers and 2 maternity clinics, and currently have an innovative and exciting health post project underway. I was first introduced to Health Builders in 2009 when looking for a healthcare initiative to become involved in East Africa. I hope to align with an organization that works closely with the Ministry of Health, which Health Builders does on a daily basis, and this ensures sustainability of our work and of our organization. In addition, having the organization led by Rwandans was incredibly important to me for shifting the power to those who are closest to the issues and who come from the communities. I am also passionate about female empowerment by providing opportunities for leadership in the health sector, which Health Builders is laser focused on. I think health inequities have had a spotlight shown on them due to COVID-19 and the unequal effect felt by different populations around the world, including lack of access to vaccines. Health Builders is on the front lines of the COVID-19 emergency response in Rwanda. As a nonprofit organization, Health Builders depends on the generosity of people like you. Because we are locally led, your donations go much further by shifting funds and power closer to the communities the aid is meant to serve. Our work has an immediate and direct impact. I would encourage you to please consider making a donation to Health Builders today, even during this event, by visiting our website at www.healthbuilders.org. Every donation, no matter the size, can make an impact and save lives. During the next hour, we're going to have an insightful time exploring Rwanda's journey from genocide to COVID-19, the lessons learned, and how the country is moving forward. We are so grateful to Susan Ormiston from the Canadian Broadcast Corporation for interviewing our very special guests, Carl Wilkens, Michel Musilikare, and Immaculate Kyarisiima. Susan will speak with Carl first for about 15 minutes, and then we will allow 10 minutes for questions from the audience. Susan will then chat with Michel and Immaculate about their experience and how it inspired them to work for Health Builders, and we'll again follow this by another 10 minutes of questions and answers. We would love for you to post any questions you may have in the question and answer text box at the bottom of your screen, and we will go through as many as possible. Although we are on a very tight schedule, we will stay on for a few minutes after the official conclusion of the event for folks who might have more questions or need additional information. And now, I would like to introduce Susan Ormiston, our interviewer for this evening. Susan is a CBC senior correspondent for TV, radio, and online media. She's reported from 25 countries and conflict zones, including Afghanistan, Egypt, Libya, and Ukraine. She also reported extensively on Nelson Mandela, covering his election and his death. Her first interview will be with Carl Wilkens. Susan, thank you so much for joining us.
You're most welcome, Nancy. I'm thrilled to be part of this. You're most welcome, Nancy. And I'm really thrilled to be part of this. And I've known you for over 20 years, and I'm so proud of the work that you and your family have done in Rwanda and with Health Builders, and what a great initiative to spend some time with today. I'm going to start just a little bit. I am the least experienced in Rwanda, but I am experienced in talking to people. So that's my role here today. And I'm going to give you a little background on Rwanda, and we're going to hear a lot more about it. It's a country situated really at the heart of Africa. It's often called the land of 1,000 hills, and you can see some of those hills in the backdrop behind our speakers. It's just a gorgeous country. For some of you, may know it for mountain gorillas and tourism. Some of you may visit it for that reason, but it also has a very sad and tragic, difficult history. Decades of complex political turmoil between the Hutu and Tutsi preceded the 1994 genocide in April, where more than 1 million Tutsis were massacred in just about 3 months. It's hard to even wrap our heads around that event, particularly because it was in the shadows, really. There wasn't a huge international spotlight on it as there should have been at the time. It has been 26 years since that genocide, 26 years of reconstruction, reconciliation, and resilience in all of the sectors, including what we're going to talk to about today, which is healthcare, and health is at the fundamental core of all of us. As with all countries under strain, cracks appear, tensions ebb and flow. We're going to hear a little bit more about that later. And of course, as Nancy has well described, COVID, I mean, it's hit all of us, hasn't it? We're not all in this together because there are huge disparities in how we get through this, but everything changed for us and for health systems in Africa under pressure. Rwanda was one of the first African countries to impose a lockdown, but we all know that there are risks and benefits, both of that, and we're struggling to figure out how to come out of that. We're going to explore Rwanda through 3 guests whom Nancy has mentioned. All have personal connections and knowledge with Rwanda. 2 of our lovely guests work inside the healthcare environment with Health Builders. But I'm going to begin with Carl Wilkens. And what you need to know about Carl is many things, but primarily for today that he experienced the genocide in 1994 inside Rwanda. He's an American. He was there before the genocide. He stayed there while many disappeared. He worked his way through roadblocks, angry gangs to deliver food and water and medicine to groups of orphans around the city, trapped. He's continued his relationship with Rwanda. And I like to think of him, when I got to know his history a bit, as an unaffiliated ambassador, not just for Rwanda, but for all of us. I'm hoping like-minded people who are with us today, who care about people beyond our personal spheres, outside our comfort zones, who have much to give to us and with whom we have much to share. And Carl calls this passion entering the world of the other. And I love that phrase because it's something I've often done as in my work as a journalist. He wrote a book about his experience in Rwanda titled "I'm Not Leaving." There's a documentary about it now in circulation, and it gives you a really good idea of his courage and the desperate urgency of those days. And I'm going to ask him to share a bit of that and then talk about healing and health. And then you can ask Carl questions in my spot. Carl, welcome.
Thanks. Nice to be with you, Susan.
Yeah, so nice to meet you. In the documentary, I want to focus on one moment that I saw on the video because it really spoke to me. And it was April 10th, 1994, 4 days into that tragic time in the genocide. You were on a radio in your office talking to the American embassy, and you had something important to tell them.
Yeah, actually, we had a radio at the house, and I was talking to Laura, young consulate officer, her job to get everybody to leave. And I said, Laura, sending my wife and our family to the ambassador's home, over. And she goes back like, well, wait a minute. What do you mean sending? We're all leaving, over. And I said, well, no, I'm not leaving, over. And this back and forth, radio over talk is going on. And really what was going on was they had told us, everybody's leaving. Nobody can stay behind. And I was communicating with a group of Americans in the embassy. But here was the problem. You know, they told us tie white t-shirts on your car antenna and go to the assembly points, and bring your family. But they said no Rwandans. Now, our family, we'd been there 4 years. Our family had grown. This young lady lived in our home, loved on our kids. That's like fast track to family. And unfortunately, she was of the Tutsi minority that was targeted to be killed. My wife and I, we just couldn't imagine leaving her there to be killed. And so, yeah.
Help us out. I mean, why were the expats all leaving? What was happening that was terrifying the country?
It was a coup. A coup had happened, launched when the president's plane was shot down, and extremists with inside the government, as well as the military, had started sending out the message, the Tutsi, the minority group in the country, the Tutsis are the ones who shot the plane down. And with that announcement, they were going through streets with megaphones and you know, a picture of the president on the truck there saying, we got to secure our country, we're under attack. The Tutsis have killed our president. And so with all of that killing, I mean, literally roadblocks set up, and the numbers right from day one were unimaginable, Susan. It was just, the world was just blown away by this, and they couldn't imagine that tens of thousands of people could be killed every single day, and the international community was leaving.
Yeah, you know, I want to talk a little bit more about that, but just stepping backwards just a second, what
Sure.
was it? Why were you in Rwanda?
We had moved there 4 years earlier, a really young family. I look at that picture and smile and that. We had come to partner with the Rwandan people to operate clinics and to build schools. And it was super, super rewarding work.
So you stayed, Carl.
Yeah.
And
The
what did you
Rwandans,
do in those terrifying months?
you know, inside our house was the young lady and the young man that I mentioned to you, as well as the Rwandan pastor, Pastor Soraya, Mrs. Soraya. We used to call her Ma. And after 3 weeks of 24/7 curfew, the government, the coup government, lightened it a little bit and said, if you got a legitimate reason, you can come get a travel permit. And I remember saying to Pastor Soraya, we got to do more. And he said, well, you know, if you're going to do anything outside of the house, you got to build a relationship with the people in power, which, you know, is rather horrifying in this situation when the people in power are the ones doing genocide. But that was the most valuable piece of advice I could get. I built a relationship with the colonel who was in the city there. He since has been arrested and charged with genocide. He gave me a travel permit. He actually sent me to an orphanage in the most densely populated part of the city, Nyamirambo. And I met this wonderful young couple. I think they're about 34, Damas Kasimba and his wife, had about 80 kids. But as the genocide was progressing, parents were looking for someplace safe to bring their kids, 100, 200, he had more than 400 kids. And his biggest problem was water. The kids were actually dying from diarrhea. So what I was doing, working together with my Rwandan buddy, Gasikwa, another colleague, Dawson, we were bringing food and water to this orphanage.
Carl, it must have been
three orphanages.
Yeah, it must have been super difficult for you to partner with people in power at that time, but it probably saved your life and saved other people's lives.
Well, there's one story, Susan, that really illustrates, just a short one, really illustrates. We showed up at the orphanage one day with the water, and we're surrounded by about 50 guys with these guns. Now, we normally just think killers, which is understandable. But the reason I want to squeeze this story in is they didn't come in for like a 2 or 3 hour standoff until, you know, we could finally get some help. A police officer showed up, and I ended up leaving the orphanage in his care, super stressed, because I thought, you know, police have killed too. But I went back to that office where the colonel was. Even though he wasn't there, his secretary said, the prime minister is here. And I'm like, well, this is the guy in charge of the genocide. And she says, ask him to stop the massacre, which just made no sense to me. And actually, I ended up asking the guy, and he did stop it. And the reason I wanted this story is that if we only see people by their worst, which is totally understandable, especially if you're just learning about the genocide, but we will miss perhaps some of the most powerful allies to stop us. There's things that you can't explain at times, but there's humanity that's always there in every single person.
Carl, I'm going to ask you to do something very difficult, and that is to just give us like a brief minute or two history of
Sure.
how it got to the genocide, because context is so important to the future.
Yeah. I always want at the center of the conversation to understand the thinking behind genocide. My world would be better without you. This exclusive problem solving. Back in 1994, we had a small group of men and women, mostly politicians, few business people, who were threatened in their positions in power. We'd had 3 years of war, and they had finally signed an agreement. They called it the Arusha Peace Accord. That was going to have this broad-based transitional government and bring these 3 years of war to end. The war had been with many Tutsi refugees who had been outside the country, wanted to come home peacefully for years, finally armed themselves, came home by force. And this small group of men and women said, no, we can never share power. And they are the ones who will launch the genocide. You know, one of the, just this extermination program that they launched, there's many tragedies there, but one of the toughest ones, and you're familiar with this as a journalist, you've been all around the world. We had 2,500 UN soldiers who were there to say to Rwanda, way to go, Rwanda, you stop fighting, peace is the way forward. And these 2,500 with their armored personnel carriers, there's very little doubt among the people who were there that they could have stopped the genocide. So while I don't blame the genocide on anyone, well, okay, there's a lot of people to blame. But this is one of the tough stories that comes out of the genocide is what do we do as an international community? What do we understand as neighbors and as people who really are inextricably globally connected? But that in a nutshell was politically driven. It was not a group, one tribe who hated another. They married each other all the time.
Well, you know, Carl, that idea of globally connected, I think that all our worlds during COVID have become more narrow. I certainly think that, even in North America. And I'm hoping that part of this presentation is to remind people we need to expand our worlds like we did before and care about the other. Now, 25 years is like a generation, and it's hard for us to imagine how a country could go through something like that and then emerge with any sense of reconciliation. I mean, how is that possible? How do you rebuild trust? I'm going to ask Michel and Immaculate the same question in a few minutes.
Yeah, it's a massive question. And each time I go back, I'm still trying to look for pieces to understand that. You probably know after the genocide, there were like couple 100,000 people accused of killing their neighbors. You can never with conventional judicial, it'll take more than 100 years. So Rwanda took this really brave, courageous step to move from a punitive mindset to a restorative mindset. They even did away with their death penalty. And in a restorative mindset, there's two things that are huge: understanding the harm and repairing the harm, as opposed to, blaming somebody and lock them up and throw the key away. They're like, that, we can't do that. And so to do that effectively, you need all of the voices. Understand the harm, repair the harm. They reached back into their history to this practice they had literally hundreds of years ago called gacaca. And they formed these community-based courts where instead of like a jury of peers, they had 9 judges of your peers selected by the community. And the community was the jury. And all of these people who'd been locked up, some of them for years, if you would confess, you could come out, confess in front of the community. And for restorative practices to happen, you need truth and you need engagement. And people would ask, where's my husband and sons buried? Did my daughter...
You actually met 2 people that you told me about who actually lived through personal forgiveness. Yeah.
They actually, the one guy went through gacaca, and from there they went into what are called TIJ camps, where they could do community service before they could get back home with the with the community. And the last thing, and then I'll tell you that couple, Gachacha's done. The Tish camps are gone, almost now, but still, like the third Saturday of every month, they still have Umuganda, where from the president to the farmer in the farthest corner of the country, they're doing projects. You know, this idea of working together to come out from under the force, the control of anger and bitterness. That's what was exciting when last summer, no, 2019, COVID took away a summer. We're there with a group of teachers and we met Maria and Filbert. Maria survived with her daughter. She would introduce Filbert as an incredibly valued family friend, but in reality, he was in the gang that killed her husband and sons. And yet Maria always talks about, you know, how he's there every planting season, every harvest. I like to say planting, harvest, because it took years to rebuild this sense of trust. Maria stopped seeing Filbert as just one thing. This kind of, you know, it's so hard when we're struggling with these types of things, not to define people by one thing. This challenge of one thing, the ability to reframe. Maria is just super inspiring in that aspect.
Well, you know, I know you're an optimist and that's an incredible story. And I'm sure there are others, but there's got to be still a lot of difficulty, tension, resentment.
Oh, yeah.
You and I are going to talk for about another 3 minutes. And then I'm just reaching out to those of you in the audience, you know, formulate some questions for Carl, because in a couple of minutes, we're going to turn to you and you can write your questions down and I'll voice them for you. But Carl, you know, the government obviously, you know, came up with some reconciliation practices, but, you know, in 25 years, lots of pressure still today, you know, ghosts of the genocide. How is it responding? How can it continue with this work?
Well, I think one of the things that they're really super intentional on is putting in place policies and procedures, what some would call good governance, and empowering people. What is it to work through good governance things? And, you know, in addition, a lot of people, and this is highlighted and well, rightly so, that, you know, a financial and technical hub in the center of Africa. But at the heart of this, you've got an incredible program of empowering women. And, you know, they said in their constitution, 30% of all of our decision-making bodies will be women. So sometimes it's
only 30.
Well, I wish. Well, reality is the parliament is more than 60%. You just take away some of those inequalities that have been there and they flourish. And those other, you know, 70% that men and women can run for, women now have half of those. And so the role of women in rebuilding the home, rebuilding the community, rebuilding the country has just been super exciting. The other one that I wanted to highlight, I was there in December 2019, beautiful convention center. I actually had a seat on the second row right there. And every year, it's in the Constitution, they have what they call Umushikirano. It's a local word for National Dialogue Council, where for 2 days, the president, all of the ministers, the governors, the mayors, they're there listening to the people. Big screens here because out in the country, there's remote locations with people set up with video cameras and they're texting and WhatsApping. They're telling the government how they believe the government programs are matching their priorities. And what was super exciting, I mean, there are a lot of stories, but they always started, before they mentioned a concern, they'd say, thanks. Like, we thank you so much for this cancer hospital in the north, but the road is killing it. Okay, Minister of Transport. There was one guy that we'll end with, who, young man, his thanks was for a scholarship, but his request was not to the government, it was to his father. His father, come to find out, is leading one of the leading armed militant groups against the government of Rwanda in the Congo. And this young man on national television is saying, Dad, come home. Now, I forgot to tell you his thanks. His thanks was the scholarship that he and his brother were studying under. And I'm like, wait a minute. I'm not only moved that this young man is asking his dad to come home, but why is the government giving a scholarship to the kid of one of their arch enemies out there. And again, I'm just brought back to this idea of restorative thinking. President Kagame said, I think it was in the 20-year commemoration, he said there's 3 reasons why and how we want to move forward in this country and why we're doing as well as we are. He said we chose to stay together. We chose to be accountable to each other, and we chose to think big. And so, yeah, there are a lot of challenges, which is primarily what the international media covers, but there's so much rock solid planning, structuring, and people working every day to rebuild their country that I love going back every chance I get.
Well, thank you, Carl. We're going to talk about some of those things that are rebuilding, particularly in the healthcare. I do have a couple of questions already from people who are listening to this webinar. One of them is, did you experience hostility when you were there from the people committing the genocide who wouldn't want witnesses?
Yeah, it was a fine line to walk. The relationship with the colonel definitely helped, but there were death threats. We had a lot of bullets our house took. And so there was that, but I think a lot of the security came in relationships, but it was definitely walking a fine line, just trying to label myself as a humanitarian and not somebody saving the Tutsi, trying to help the Tutsi people. And that's what, the Pastors Council build a relationship with the people in power that had a lot of aspects to it. And one of them, a lot of benefits. And one of them would have been security to one degree, but no, it was terrifying.
Carl, an obvious question and a good one is you've talked about several examples of where there has been forgiveness and structures in place for reconciliation, but do you believe, one of the questions to you is, do you believe that Hutus and Tutsis can live together in peace?
Oh, absolutely.
And now?
Absolutely. The young lady, the reason that my wife and I chose for me to stay, that young lady in our house lost almost all of her family. And after the genocide, she got married to a man who had a Hutu ID card. And people are like, are you kidding me? Your family's killed by Hutus, you married? I mean, they don't say that. They say it to each other, not to her face. And what so many people in Rwanda understand is that it wasn't Hutus who killed, it was extremists who killed. And some people think, oh, well, that's a minor point. No, it's not. That's a major point. The way we categorize and we label people, or we simply see them as one thing. So this is, her husband, I have no doubt, had no part in the genocide. And they fell in love and got married. But even the people who had parts, I had another survivor friend who said to me the other day, I was angry at first for years as a little kid growing up, a teenager. But then I started thinking, why were they doing what they did to the reasons behind the actions? And he started examining those reasons behind the actions. And that's when he began to find freedom from this anger and bitterness. I know it was just a quick story, but this idea of defining people by one thing, man, talk about America, huh? Oh, there's a Black Lives Matter sign. Oh, I don't need to know anything else. That's one. Oh, a MAGA hat. I don't need to know anything else. Well, so this one of the big takeaways from that is this idea of guarding, resisting this urge to define people by one thing. And I don't blame anybody who, for example, defines somebody who killed their family by that one thing. No, never am I going to criticize that. But I have seen people in Rwanda who have said, no, there's more, and that we can be more. I'm a big fan of Brian Stevenson. We can be more than the worst thing that we've ever done. And I've seen it again and again. But there's also people who are still angry, without a doubt, and people who say, I would never want my child to marry. And so it's a spectrum, like anywhere in the world.
So just stepping off, you hit on two questions that I'm going to fire away very quickly here. But the one point you just made, I mean, yes, there are people still angry for sure, inside and outside the country. So what risk is there of another genocide or civil war or insurrection?
it's an impossible question, but it's a valuable question. And the reason I think it's valuable, you can have somebody who has gone through genocide and actually like flipped over and become a killer. And now, like Philbert, who I put on the screen, this lady is saying an incredible, valuable family friend. Here's my point. People who went through genocide, they're the ones, not people who are outside witnessing, outside the country, but people who went through genocide. Those ladies I showed you a little while back, we were asking them, how are you coping with this grief and this loss? And they said, we thought we were going to drown, and it's actually love that has rescued us. And I'm like, what? And it's a radical type of compassion and empathy. You may not have compassion for the person in prison, but you see their children suffering and you take in their children. And those stories are by the thousands in Rwanda. Step by step, the journey begins, whether it's through their children or through some other person. It's like, this guy saved my wife and he killed my father. How am I supposed to relate to him? And when people have opportunities to have security and then start to learn the truth, like Gachacha was, and opportunities to interact, as awkward and difficult as it may be at the beginning, we start to see leaders emerge like Maria, who say, I know it's hard. And for some, it may never happen, but it's possible. And that's what makes the difference. To have that hope that it's possible is what keeps a lot of us going.
Yeah, for sure. I've got about one more question for you, Carl, in our time here, and really it's an amalgamation of several questions that have come in, and you touched on it. Many Americans, I'm assuming, are listening to us, so they're asking, what lessons for restoration? Deep divisions in this country, don't we know it? Having lived through the last few years, particularly deeper than they were years ago. So can you identify types of things that they can teach us in America about healing some of the divisions here?
One of the ones, and I'm super passionate about this, so forgive me, you might have to tell me to settle down a bit, but we often think there's just one way to do stuff. And that's the American way. And we think that, when somebody commits a crime, we try them and we lock them in jail. And then somebody says a different way, restorative, and we find all kinds of things to say, oh, well, there's no consequences or anything to that. And that's a slap on the wrist. Rwanda has shown it's not a slap on the wrist. There's consequences. And people actually in the consequences, like those people that I mentioned were doing community service in the building roads, radical terracing and stuff like that. Those people, even though their prison time was cut in half, I would argue that their transformation that happened in them and in the thinking of the people in the community who saw them kill, but then saw them day after day, month after month, doing things to make the community better, not paying back, can't pay back for killing somebody, but showing that there is another way. That is really powerful to me. This idea of restorative practices isn't just for the judicial system. We're seeing it in our education here in America. You can look at several schools, whether it's the Oakland district or Denver school. You can see people who are picking another way that says, yeah, somebody's to blame, but if we just blame, we won't heal. We have to repair, and repair calls for everybody coming together. And not just, the lawyers or somebody who has something else to gain. It's messy, it takes time, and we often don't think we have the time, but I would argue we can't afford not to take that time. And it's so different when these offenses happen within the environment of a community that already is intentional about building relationships. If we're only starting to talk about it when we have a crime or a problem, it's going to be super uphill, but it's still possible. That's what happened in Rwanda. But that building of a community of understanding, of not defining people by one thing, those are some of the things that Rwanda has really changed my thinking about.
It's a massive hill to climb, but you've given us some great ideas. Thank you, Carl, very much. And reminding
Well, thank you.
listening to us that I think Carl's going to stay around for a few minutes after this ends. If you have more questions, there are some more that have come in that I haven't got to, so please hold them in your pocket and we'll get to them. Thank you, Carl. Thank you so much.
Pleasure. You're easy one to talk to.
Sometimes. I'm going to move on to our two guests with Health Builders who experienced the genocide intimately, both in different ways. They are both Rwandans. They are both giving back to their country now in the health field, and I'm thrilled to be speaking with both of them. I'm going to start with Immaculate Kyarisiima. She's a nurse. She has a master's in public health, and she's now director of programs and development at Health Builders. She has worked her way up from extreme poverty, growing up in Uganda as a child of refugee parents who fled to Uganda, taking advantage of scholarship, hard work, and I'm sure, Immaculate, a lot of grit. And she's been with Health Builders for the last 6 years. Welcome, Immaculate.
Thank you so much, Susan.
I'm thrilled to be talking to you again. You were about 5, Immaculate, living in Uganda with your Tutsi parents when the Rwandan genocide was at its worst. They had fled Rwanda years ago, much earlier, struggled a lot in refugee camps, and you were educated back in Uganda, but you made a decision about a decade ago to return to Rwanda. Why?
Yeah, actually, when I started school in Uganda, at school, our fellow students could mistreat us, telling us that we are not Ugandans, that we are Rwandans. So when I could go back home, I could ask my grandparents and even my parents that why is that? So they told me that my motherland is Rwanda. So I always had a dream that one day I have to go back. I mean, I have to go to my country, Rwanda, and if at all possible, take my parents back to their homeland. So I grew up with that dream and passion because of the mistreatment that we are getting in Uganda.
Must have been super hard, though, when you arrived in Rwanda as a young woman, starting over in a country that you didn't know but was your soul. You talked about your dream of going back. You met your husband, who was a young child at the time himself in Rwanda during the genocide. His parents, and I believe his whole family, Immaculate, were killed. He was orphaned. So what did you learn about the genocide from the man that you loved?
I learned that there is this kind of transgeneration trauma.
Lost Immaculate there.
Can you hear me? Can you hear me? Can you hear me, Susan?
Yes, I can hear you. It's a bit in and out, but continue talking and we'll, yes, I can. Yes, I can. Yeah.
Oh, good. Yeah, sorry for that. So I was saying, I've learned.
I can hear you in bits and pieces. Yeah.
Oh,
no problem.
I think the problem of internet. So I've learned that actually genocide even affects those who did not witness it. There is this kind of transgeneration trauma where even children who were born after genocide, you know, the second and third generation, you know, are facing the trauma symptoms, even though they did not witness genocide happening. So I can say that genocide really has that physical, mental, and social impact even on the second generation. And this is what happened to my husband, Innocent, because he was by then 6 years old. But now he can still, you know, have that kind of trauma. You know, I was not able to see my parents. I was not able to see even one of my siblings. So like other, you know, other young generation, they are still living with that trauma.
Now, Immaculate, we heard Carl talk about it, but you who's lived it do you believe that there can be long-lasting reconciliation, and how does that happen in your own life?
Yeah, for sure. I do believe that there can be a long-term unity and reconciliation, given Rwanda's effort towards, promoting unity and reconciliation. And the government has really instituted different programs that are targeted at improving unity and social cohesion. Examples of programs include the Umunyarwanda, which means a Rwandan. And this calls out for all Rwandans to know that there is no Hutu, there is no Tutsi, they are all Rwandans. And the young generation is growing in that mood, knowing that they are all Rwandans, there is no ethnic differentiation. So seeing the country's effort trying to avoid discrimination and segregation, we really believe that genocide won't happen again. And even Rwandans have learned a lesson, I think. So all the programs are now really targeted at avoiding a kind of discrimination, and even anyone who shows such kind of behaviors trying to discriminate, it's seen as something unacceptable. So we believe that genocide won't happen again in our country.
Wow. Well, we hope, and with fervent hearts, that is true. Immaculate, in America, where I live, we argue about healthcare. How much, how little, private, public, how much, who pays. There is an abundance of healthcare here, even though the access is very unequal and can be hugely expensive. But in Rwanda, you're tackling much different needs. What are the most urgent healthcare needs, and how are you tackling them?
Mm-hmm. Yeah, thank you so much. So actually, there are very many critical needs in the country, despite of the progress that the country has made, but still there are gaps. And these are some of them which are being addressed by Health Builders in collaboration with the Rwandan Ministry of Health. We have examples of the needs. There is insufficient knowledge among healthcare providers. So being able to provide treatment, even being able to assess and diagnose patients according to the treatment protocols. So there is a challenge, and here Health Builders has been really helping out to train nurses and midwives on treatment protocols so they can treat patients according to the standards. Another gap is there is insufficient life-saving technologies, especially at the primary healthcare centers. And an example is ultrasound. So these are machines that detect complications among pregnant mothers. So you find they are not present at the primary healthcare centers, and that means pregnant mothers have to move long distances to be able to get access to those ultrasound machines. And here we have an example. Health Builders have managed to pilot ultrasound technology in 7 primary care centers. And this has really helped mothers to access these services at the nearest health centers. But there are other health centers which are not having these ultrasounds, and it's a challenge, especially to pregnant mothers. Another challenge is especially for adolescents, young generation, where they are not able to get access to sexual reproductive health services. And there are many reasons, cultural barriers, religious barriers, going to the clinics and they don't find youth-friendly services. And here again, an example, Health Builders have piloted adolescent sexual reproductive health program in 15 clinics, and we have seen it work. It's helping adolescents access contraceptives when in the past they are not accessing them. We have seen adolescents, get access to information because we provide educational materials. So another challenge is limited health infrastructure. So despite the fact that the country has progressed in healthcare infrastructure, there is still a limitation where like a large population is still walking long distances to access healthcare facilities. And imagine a pregnant mother walking more than 2 hours, a child who is seriously sick, being carried on her back to walk again those 2 hours. So it is a challenge. And here again, Health Builders have partnered with the Ministry of Health and the local government and have so far constructed 7 health facilities and 2 maternity wards. So there are those many challenges, they still exist, and Health Builders is really working hard with the Ministry of Health to address some of the challenges. Yeah.
That's a really good picture, Immaculate, of what's needed and also what's happening. And I'm sure amongst all of that is the complications of COVID and internet accessibility. And I want to reassure you that that little problem we had a minute ago was my internet here in the capital of the United States, not yours. So there you go. Immaculate, thank you very much. Again, you'll stick around if people have other questions for you, and Michel, we'll get back to you in a few minutes, but I do want to turn to your colleague, and thank you, Immaculate.
Thank you so much, Susan. Thank you so much.
Your colleague, Michel Musilikare, is the Executive Director of Health Builders. Michel, you've been working with them for 13 years. You told me it was the longest you'd ever stayed in a job, because I think they must be treating you well and you like what you're doing and you've had some impact there. But I want to talk to you very briefly about you during the genocide. You were a young man. You were just about to attend your first year at university, and I want those listening just to imagine what that must have been like. Here you were with your future ahead of you, and you'd survived attacks on your own village in April, May, June of 1994, and then in January you started university. It's hard to even imagine university starting up then, but what was it like, Michel, when back then for you and your colleagues, your friends trying to go to university?
Yeah, sure. Thank you so much, Susan, for the question. Actually, I would say that genocide was a terrible period. It was 100 days of really bad things. So we saw people who were acting as animals, not just human beings. So exactly on 7th, when the genocide started, people came to my home and they were drugged, they were wearing machetes, all things of weapons. And they had started killing people. And you would say, you would even think where are they coming from? Because the days before we were living in harmony with all neighbors, everybody, yeah, so we had total security, though we had some signs of genocide preparation, because people were being killed here and there, but it was not really such a generalized situation. Then during that period, many people were killed, and we really survived hardly. And as you mentioned, I had finished my secondary school and I was about to start my university. Just immediately after the genocide, early in 1995, in January, the university reopened, and I went there, and it was really, things were different. So I just started hearing that most of my friends, classmates, and even some relatives had been exterminated with their families. So people really had scars at that period, and there were many orphans and widows. So at that period, there was no hope for the future. So everybody was traumatized by this.
Yeah. Michel, you also told me, forgive me for interrupting here, you also told me that during the genocide, what we didn't mention was that a lot of the professionals in the healthcare industry, doctors and nurses, were killed or fled, so you had to restart.
That's when they started reconciliation and reconstruction programs. Can you hear me?
Yes.
Okay, thank you. So they started unity and reconciliation programs. We had things we call ingando, bringing people together and then educate them on unity and reconciliation without any differentiation, Tutsis and Hutus together. And then telling them that, as Michel mentioned, they are all Rwandans. They have to live together. There's no way Rwanda will be for only Hutus or Tutsis. It's our country, all of us. We have to live together. So the government took that step. So they bring people together in those education camps, starting from maybe people educated, teachers, healthcare providers, because at that period, all sectors of the economy were really destroyed, including healthcare systems. Many health facilities had been destroyed, healthcare providers had been killed, and others had fled the country to DRC, Tanzania. And those who were in country, some of them had been complicit in the genocide.
Yeah.
So it was hard, and the population had no trust in the healthcare system.
Michel, we're going to turn to questions from the people with us on the webinar very shortly here, but just very briefly, Immaculate talked about what's needed in healthcare. What would you add to that about the quantity and quality of healthcare in Rwanda and rebuilding that?
Yeah, thank you. Yeah, there is a big improvement since the genocide. The government decided to decentralize healthcare system. So they developed infrastructure and to bring healthcare close to the community. So we started by a policy of having a health center in each administrative sector, covering a population of approximately 20,000, and Health Builders helped the government in this. As Michel mentioned, with the support from different development partners, we built 7 health centers and 2 maternity wards. And now we are also supporting the government in the next level of decentralization, which is health posts.
Right.
So a health post will be covering a population of approximately 5,000 people. So the need are still there because health posts are very few. We have to cover all the cells of the country to have a health post in each cell. And also the healthcare providers, there's a need for healthcare providers. They are still few. So if we see the ratio of a nurse or a doctor per the population is still low. And those healthcare providers also need training. And this is what Health Builders is doing. So we are training them to boost their clinical skills as well as management skills. So the health centers are managed effectively to provide quality care of the communities.
Michel, that idea of training,
yeah,
is very important, and I've heard that from you and Immaculate. I am getting some questions from people with us on this webinar, and Immaculate, I'll ask you and Michel just to stand by here for them. One of them is, of course, about COVID. Michel or Immaculate, what are the biggest challenges of COVID in Rwanda, adding to the problems and the challenges you've already expressed?
Yeah, thank you so much, Susan. Rwanda, as the whole world, has really been affected by this COVID-19 pandemic. So actually, the healthcare systems are still to be strengthened, and then COVID-19 came. So you will see that healthcare providers are now being distracted by COVID-19. So Health Builders is there to try to make sure that the existing healthcare services continue to be offered despite the COVID. And we are also part of COVID-19 emergence team in each district we are supporting. So we are making sure that the health centers are not a center of, how can I say, spread of COVID. So
Yes.
yeah, we are making sure that measures to control COVID are being put in place, including washing hands, social distancing, wearing masks. We are training healthcare providers. Among of our interventions, we have infectious prevention and control. So we train them how to really control the infections as well as to control COVID-19 spread.
Thank you, Michel. I'm going to bring in Immaculate here just on that question again. Are you having a vaccine? We hear, you know, so much about it here. Are you getting vaccine? Is it scheduled?
Yeah, actually yesterday, the first package of vaccines landed in country, and they have started actually vaccinating the frontliners, the healthcare providers. Yeah, so, but of course, the burden is high. We are not sure if we get more vaccines to be able to cover the healthcare providers and or the entire population, but at least the government has taken a step of bringing the first package, and the healthcare providers, as they are the ones who are really at risk, they are getting the vaccines.
Immaculate and Michel, we never have enough time, and I know that you're going to stay around for other questions, but I have one final brief question, but brief answer. Immaculate, you had a dream to return to Rwanda and bring your parents, which I think you did.
Mm-hmm.
Now, what's your dream?
What am I doing?
Now, what's your dream, your new dream?
Oh. Yeah, so my new dream, you know, is so I can be able to keep supporting my family and again be able to keep serving my country through Health Builders organization, because it's an organization that I love most because of the critical work that is doing to address the health needs of all Rwandans. So in my next 5 years, I want to see myself growing more professionally so I can be able to contribute effectively to my country.
Well, we wish you well towards your dream. Michel, in a few words, your dream?
Yeah, thank you, Susan. Actually, my dream, I'm towards actually my dream. My dream is to having Rwanda health systems really strengthened and strong enough to serve the communities. And we are actually heading there, and Health Builders supporting that. And I'm really very happy to be leading a team of healthcare professionals and advanced nurses like Immaculate, many women and men who are really very motivated to strengthen the healthcare systems in Rwanda.
Well, I want to thank you, Michel and Immaculate, for giving us a really wonderful inside look at your country, the health system, the health challenges, and perhaps giving us some ideas about what we and other places can do to help. And thank you so much. And I'm going to turn this back to Nancy Reynolds, who's been quietly listening away, to give us some final remarks.
Susan, thank you so much for the interviews, and thank you to our wonderful panelists. I think it's been a really wonderful and informative hour. We'd like to thank the attendees so much for joining us, and we hope you found this as insightful. On behalf of everyone who has joined us, I want to thank you, Susan, for guiding us through this discussion. And an incredibly big thank you to Carl, Michel, and Immaculate for their willingness to share their stories. I can imagine this is difficult to do, as could some of the audience members who are writing messages to thank you, but it helps so much in allowing us to learn more about this beautiful country, your amazing and resilient people, and the importance of organizations like Health Builders as they continue to build an effective and safe healthcare system. We would like to invite anyone who would like to stay on for a few minutes to ask additional questions to please do so. Michel and Immaculate and Carl have agreed to do this with Susan to make sure we answer any of the outstanding questions, and there were quite a few. Since some of you may need to drop off now before more questions, please be sure to visit our website at www.healthbuilders.org and consider making a donation. We thank you again for your time and joining us for our first virtual event. For those of you staying on, please continue adding questions in the Q&A box. Thank you. And I'm now going to hand back over to Susan. Thank you.
Thank you, Nancy. I'm going to turn back to Immaculate and Michel for a few more minutes because there were several other questions. Immaculate, we heard about the challenges of the healthcare system, but if you had to name one or two, what would you say you still haven't achieved and have some ways to go on?
Yeah, thank you so much, Susan, for asking that question. So the two most critical ones that I would mention, one is being able to maintain a number of healthcare providers with sufficient knowledge and skills to be able to provide quality care to patients. The second one is the one that I mentioned in our first conversation about the challenge of life-saving technology. As you can hear the name, it's life-saving technology. So, and this is especially most important to the mothers and children to be able to save their lives, children when they are still young, so that they can be able, to grow up and sharing again an example that this life-saving technology, when they are not present at the primary care facilities, some of the children, the neonates, die before they reach the advanced stage. But with this life-saving technology, they can be able to be saved at a younger age, and even mothers, when they are still pregnant, complications can be detected early, so they can be sent to higher levels for further management. So those are the two that I would mention.
Thank you, Immaculate. Michel, we had a couple of questions about leadership, which is your position. And, I don't have enough history of Health Builders to understand exactly the questions, but I think what they were asking is, transitioning from expat leadership to local leadership. You're the first local executive director, so you're building that as well. But what have been the challenges there?
Yeah, the main challenge was that actually, as you mentioned, most of the organizations, especially INGO, international NGOs, or even local NGOs, have been for long been led by experts. So now being actually transitioning from experts to local leadership is now a discussion point. So because actually local leaders know where the need of their communities, they understand where the need of their communities, and also the communication is easier when you are actually communicating with your counterparts. But the main challenge would be actually access to funding. Mm-hmm. Yeah, because most of the funding is coming from Western countries. So actually access to funding is a challenge for local-based organizations or local-led organizations. And most of multilaterals are giving their funds to international INGO led by those experts because of their mechanisms or their criteria for selection. They are really hard, but we think that they should actually change their mind because local leaders, they really understand what are their needs. And they know which solutions they can bring to their communities because they live together with them. They know which can work and which cannot work in their environment because they share the same culture, they share the same values. So I would mention that in Rwanda, we have seen many homegrown solutions working well. They were actually from the culture of Rwanda or even from the history of Rwanda. Carl mentioned some of them. He mentioned the Gacaca courts. He mentioned Umuganda. And we have even used, at Health Builders, we have used some of these homegrown solutions in building health centers, the local communities contributing their labor through this community labor. So this is what I wanted to say, that actually local, the main challenge is actually accessing to funding.
Yeah, yeah. Carl, are you still with us? Carl Wilkens?
Yes,
Yeah.
yes,
Carl,
I am listening
to,
intently.
yeah, I wanted to bring you back in for a second to ask sort of a bigger question about, you know, have you experienced in your work that during this COVID time, you know, what I referred to initially about our world's getting smaller, that it's harder to engage people and therefore to engage people's interest and funding to look outside their circumstances now. Would you say that this is a added difficulty for organizations like Health Builders?
You know, I can't speak for Health Builders, but I do, you know, I've seen it as a mixed bag. You know, in my work, I work primarily with teachers. And the other day we had a conference with teachers in South Africa and America, which we wouldn't have had if it wasn't for COVID. People are becoming so comfortable with Zoom now that we're finding out the barriers of, like, I can't afford to fly somebody there. Well, hey, I can bring 3 people into our conference at the American School in Warsaw with Zoom. So I do feel we need to just, you know, I was just thinking as we're sitting here talking, I want to do a Zoom session with Michel and Immaculate, just myself, you know, and it's possible now. Those possibilities are there. I think our challenges are the, as Michel was saying, the communication set up. So, I mean, there's no doubt COVID has been draining on our resources and it's been draining on our emotional, mental thing. I can guess sometimes people say, you know, I don't want to attend an event because I'm already up to here with emotional baggage and, you know, of the challenges of COVID. So I wouldn't want to minimize that side of things, but I do think that a lot of opportunities have been opening up, at least from my perspective, with the Zoom possibilities right now. And we're looking at, I would love to see ways that we could have a conversation between, you know, nurses in America and nurses in health. You know, we'll have to brainstorm with Nancy about that later.
Well, that's a very positive take on it. Immaculate, what would you think about that? I mean, one of the questions we had from the audience is whether there has been sort of cross-nation cooperation in the healthcare system. Like, do you have alliances with countries outside Rwanda's border that where you can share ideas about how to build your healthcare system?
Yeah, thank you so much. One example of that inter-country collaboration is the human resource. We call them HRH, human resource for health. So they have been in Rwanda for some good years, and they have really been helping train doctors and nurses. But I think their mandate is close to the end, if I'm right. Maybe Michel can correct me. But we have really seen this help because they bring that international expert to the local team. So Health Builders, if gets a chance like to have that intercultural expert, like from a collaboration maybe with you know, Carl Wilkens or others, it would be a strong addition to the country.
All right.
Can I add something on?
Yes, please, Michel.
Actually, at Health Builders, we are also doing this inter-region cooperation. We are doing what we call learning exchanges.
Mm.
So we are doing visits to Burundi among NGOs. We are partnering with the LifeNet, going to Burundi, learning what they are doing there. They are also coming to Rwanda to learn what we are doing. We also did the same in Togo, Uganda. So they are learning our approach, and then we are learning their approach. So they are learning how Rwanda health system is organized and the structure, and we are also learning their structure. So there is this cooperation between NGOs and exchanging learnings.
Well, that's wonderful to hear. I think that we probably are going to wrap unless anybody else has anything they want to say to our audience.
Just thanks to everybody and for tuning in, and excited to continue the journey.
So nice to meet all three of you, and Nancy Reynolds is going to wrap things up for this extended version.
Nancy, you are on mute. Nancy, you're on mute.
Thank you, Michelle.
There you go.
Thank you again, Susan, for all your time and your expertise. I think you led us through a really meaningful and insightful discussion, and we're most grateful for it. And to our panelists, thank you for all your openness and willing to share your stories, no matter how difficult they are. I think you enrich all our lives by what you do on an everyday basis and by your sharing. And thank you very much to all our participants. We're enormously grateful for your time and your interest in the organization and the story of Rwanda. We hope to see you all again soon. Thank you very much. Good morning, good afternoon, and good evening.
Thank you so much, Nancy.
Thank you. Bye, everyone.
Bye.